Hi, I'm Dr. Tieraona Low Dog, and today I'd like to talk about a study that came out recently that I think got a lot of attention. It was published in the Journal of the National Cancer Institute, and what it showed was that men who had been eating fish or had been taking fish oil supplements actually had a 43% increased risk of prostate cancer and a 71% increased risk of aggressive prostate cancer. That's worrisome. Many men called. My father, who has prostate cancer, called. It was very concerning. I'd like to take a moment to just actually show you what the study said. This was a group of men who'd been enrolled in a study called the SELECT trial. It was a large group of men who were enrolled to study the effects of vitamin E or selenium or both, or versus a control group, and see if either of these supplements help prevent prostate cancer. At the baseline, before they enrolled them into the study, they took a bunch of blood tests, and one of the blood tests they took was an omega-3 phospholipid study, a panel, to get a level. So they had this baseline data, and then they randomized men into the different groups, and they followed them over a number of years. So this study was designed to look at vitamin E and selenium. It was never designed to look at fish oil. They only took one blood sample the entire time that the study was undergoing over many years. And what they found was, after the study was done, they looked at men who developed prostate cancer and then went back and looked at that original blood test and said, gosh, men that had higher levels of omega-3 fatty acids at the beginning of the study had an increased risk for developing prostate cancer. There's a lot of problems with that. One is that study, testing phospholipids in this kind of way, is a very difficult way to assess your overall omega-3 status, because if you ate fish the night before, if you took a fish oil supplement in the morning, it would have affected those phospholipids. It doesn't tell you over time. The fact is, they didn't check the men's blood levels of omega-3s when they were diagnosed with prostate cancer, which would have been much more helpful. So we had one data point in time and nothing else. The other thing that I would say is that when you looked at the average level of omega-3s in these men's blood at the beginning of the study, they were actually fairly low, especially when you consider those blood levels compared to Japanese men who have a very low level of prostate cancer and whose omega-3 blood levels are much higher than these American men were in this study. So bottom line for me is, I would say that the totality of the evidence shows that eating fish regularly actually reduces your risk of heart disease and actually can reduce your risk of cancer. So I'm still a big advocate for people eating low mercury, cold water fish, and/or taking a fish oil supplement if they do not choose to eat fish. Remember, when you're looking at science, you have to look at the totality of the science, not just one study.